It will be about the Danish perspective. Of course, clinical risk management is mandatory, and it's actually a basic part of the professional life as a chiropractic clinician in Denmark or any other kind of authorized healthcare professionals in Denmark. As you might know, the chiropractic profession in Denmark is authorized by the government and also regulated by the government. Chiropractors have a 5-year degree at a research-based university education at the University of Southern Denmark. We have a 1-year internship to get licensed to practice as a self-employed chiropractor. And we also have a CPD program at the Chiropractic Knowledge Hub. We are so fortunate that there is a government-established patient incident reporting system. It's called UTH, and that goes across all the healthcare professional parties in Denmark. It's under the Danish Safety Authority. It's a support system, actually, to learn from our mistakes, or from all mistakes done in the healthcare system. This will ensure some kind of transparency. There is an ambition, actually, to erase the zero-mistake culture that takes place in healthcare. These Danish safety authorities, they have a very, very strong focus on learning. The incidents, they are registered in a central database which researchers can apply for to get access to these data. This is across all healthcare professions. If harm is done, on top of that, we actually have a government system where a patient can apply for compensation. So this is a so-called no-fault insurance system paid by the government. We don't call it malpractice. That's also a different approach, I think, as I've heard from some of the other speakers. And of course, it's mandatory that clinicians, chiropractic clinicians, they adhere to clinical guidelines. And they are done by the Danish health authorities. We don't have to come up with them ourselves. We were so fortunate to have the CEO of the Danish Safety Authority giving a speech at our last professional conference in November 2020 in Odense. And she actually ended up her speech by saying that the chiropractic profession is a profession who does very little harm. So this is done from an outside person overlooking the complete healthcare system in Denmark, which I think is a very, very good take-home message for this audience. So that'll just be my words for now.
Thank you.
I want to thank the WFC for this invitation. As many of you know, I'm a nurse, not a chiropractor. So it means a great deal to me to be able to come and talk to you as an interprofessional colleague. And while I'm a chiropractic researcher, I also see the world through the lens of being a chiropractic patient myself, as well as the mother and daughter of chiropractic patients. And so I'm always kind of watching for how things are going. And it's important to remember that entering into the role of patient within any healthcare discipline is an inherently risky business. An estimated 4 in every 10 patients within outpatient settings, such as a chiropractic office, will be harmed by unsafe healthcare practices. While many of the known harms from healthcare occur from prescription medications and surgical errors, chiropractic patients remain at risk for treatment-related adverse events, radiation errors, healthcare-associated infections, and as we've heard earlier, and most critically, overdiagnosis and diagnostic errors, potentially leading to delays in referral and treatment. And yet, the chiropractic profession has published relatively little perspective of patients. And as the World Federation of Chiropractic positions itself as EPIC, evidence-based, patient-centered, interprofessional, and collaborative, the time is now to engage patients, family, and our professional colleagues in initiatives to make chiropractic care even safer. As the WFC Global Patient Safety Task Force gets launched, we're really being guided by the World Health Organization's Global Patient Safety Action Plan, which is 2021 to 2030, and I hope all of you will go there and look at it and think about where chiropractic might fit. I think two of its guiding principles, that of engaging patients and family and achieving results through interprofessional collaborations, are particularly important. Patient and family engagement encourages health professionals and organizations to learn from patients' experiences, small and large, to move the profession towards safety improvements. As a mom, I had that experience with my son, who on a Friday got an adjustment that didn't quite go right. And he had a lot of pain, discomfort, not able to move this shoulder for the whole weekend. And to spend a whole weekend of the office is closed. What are we supposed to do? Hang in there till Monday. Couldn't that be improved in some way? I think so. Such engagement includes